Okay, so it is Monday. So we begin with the mind on Mondays. So at Springfield College, we have spirit, mind, and body. And I've chosen Mondays to focus on the mind. So we do a little mindfulness meditation on Monday. So this is a point where I'm going to play. It's a 5-minute meditation. My students have seen it before, but I really like it to get us set up for class and set up for the week. So everyone is welcome to mute cameras and audio and just kind of relax for the next few minutes and build that focus. So here we go.
Grounding into presence. Find a comfortable seated position. Sit upright with a straight spine, relaxing all of your muscles and allowing your shoulders to gently relax downward. See if you can feel awake and alert, but at the same time a sense of relaxation and ease. I invite you to close your eyes or simply gaze in front of you. Next, bring your attention inward and simply notice how it feels to just sit right now, exactly as you are. Take this opportunity to simply be here. You have arrived in this moment. You don't have to do anything. You don't have to be anywhere else. Just take a moment to simply be present. Take one nice deep inhale and one nice long exhale. Now we're going to take an opportunity to turn off or quiet down our thinking minds for a moment by anchoring our attention just in the sensations of our bodies. First, draw your attention all the way down to your feet and simply notice how your feet feel right now as they rest on the ground beneath you. Feel that connection of your feet to the floor. You may feel the gentle pressure of the floor underneath your feet. You may feel your socks or your shoes against your skin. Simply allow your focus and attention to tune into how that feels. Simply notice all of the physical sensations there. Next, draw your attention upward and ground your attention just in the sensations of your body sitting in the chair. Can you notice all of the points of contact your body is making with the chair? Can you feel a sense of weight or gravity? Next, scan your whole body and notice if there's any place where you're holding tightness or tension. Tune into your neck and shoulders for a moment and see if there's any tightness or tension there. Allow those muscles to simply relax. Allow your shoulders to soften and relax downward. Now tune into your jaw and simply relax your jaw. Notice your facial muscles. See if there's any tightness there. Relax your eyebrows and your forehead. And simply allow all of the muscles in your face to loosen and soften. Next, open your awareness again to your whole body. And take a nice deep inhale, noticing how it feels for your whole body to fill with air. And as you exhale slowly, allow any remaining tension or tightness to simply release. Taking another nice deep inhale, creating openness and spaciousness. And with your next exhale, simply let go. Allow your body to relax and soften and sink into the chair beneath you. See if you can connect to this sense of being present throughout your day. If your eyes are closed, I invite you to open them.
Okay, so if anybody felt like they were running around a little bit this morning or getting themselves organized for class, it's always good to take a moment and center a little bit. And I'm gonna make sure I've auto-enabled our live transcript, but you can always turn those subtitles off. So in the chat, let's just check in. How are you today? And you don't have to wait for my cue. You can go ahead and. Yay, Sam, you went to bed early. I know that was your goal. Good job. I'm going to give a reaction clap. A little clap for Sam. Good job. And I'm seeing a lot of that feeling of tired, but calm. So a couple of folks feeling like the meditation helps maybe center, get some of the worries and tired feeling. Emily Bomar just had an anatomy exam, so we hope that went well for you. Okay, so let's jump into some content this morning. So this class is clinical procedures, to give a little context, and it is a class about the how-to of being a speech pathologist or audiologist. So we've covered getting that first referral for a client or patient or student and what you might do in response. Students have written about assessment planning and writing an evaluation report, and they've just covered writing an initial treatment plan with some initial long-term goals and objectives. So the next step in our clinical process is to think about an individual session, so an individual therapy session. So today we're starting to talk about session planning, which we often think of as a lesson plan, because you're kind of planning out what you're going to do. But I definitely want to think about it more broadly, that it's a session plan, because it's not always going to be called a lesson plan, but you go into every session with a sense of what is going to happen, right? You might follow your client's lead a lot and really follow their guidance, but you're always planning what's going to happen in your sessions. So that's what we're going to talk about, some of the logistics for that to get started. And then I have a bit of a practice case. And the practice case is just to get us thinking about what kinds of things we might plan. And then the next time we have our class meeting, we will talk more about some of the other aspects of session planning, and I will provide you your next case assignment and your next team, so the next group project. So any questions before I jump into a little bit of session planning? Okay, and then just to get some context, in Brightspace, in the folder, along with today's notes outline, there's the voice pieces in that same content area. And then who has their HEGD book handy? Except Mia, obviously. Okay, great. So as we are looking through, your assigned reading for next class is chapter 9. So if you've been taking a look at our week schedule and all of those materials, chapter 9. So I'm going to give you a bit of a preview for some of those aspects, and then you'll read a little bit more into it after class for tomorrow. The other thing I want you to take note of is on page 302, it starts to give you some examples specifically for voice. So again, I reiterate how much of a resource this book is, that it really gives you concrete examples. So when I said we're going to do a voice practice case, you probably got a little nervous because you haven't had a class in voice, but we've got some tools right in the HEGD book. So keep that handy. And then I'm going to do a share into the PowerPoint. And if you have questions, just go ahead and chime in, unmute, put them in the chat as we go. And I'm just making sure I'm sharing the right screen. Okay, so session planning. So as I mentioned, this is a preview for your next assigned reading chapter. So as you go through the chapter, you're going to feel like you've got some familiarity. And this is what we're covering when we talk about session plan. So these are all the aspects that we're talking about. So the targets in your treatment plan, the things that you've said you're going to work on relate back to actually planning session by session. And sometimes you might plan for the week if you have a few sessions or a couple sessions in that week. Sometimes you really are kind of planning session to session because of the pace of the changes of the client. So we're going to cover these components. We've covered objectives, but that's your basis for developing your session plan. So your long-term objectives, those short-term goals and objectives, they get broken down even further to your session objectives, which may also be called short-term objectives, depending on who you're asking in your work setting and those things. So a little vocabulary soup there, but the definite premise is that this level you're planning for individual sessions or maybe a couple of sessions. And I've put a few examples of lesson plan formats in Brightspace. These are 3 different examples, but there's lots of ways to structure. So just to give you a sense of how these pieces of information might come together. So let's begin talking a little bit more about this idea of methods or procedure. Figuring out, well, what exactly are we doing to target these objectives in the session? Where are we trying to take this? So we're going to think about what procedure are we using? So are we trying to evoke a target behavior? Are we trying to create a target? Are we trying to increase a target? Are we trying to strengthen or sustain a target? Or are we also incorporating strategies to control some undesired or sort of interfering types of behaviors? So you really want to have this purpose in mind when you're writing those session objectives, when you're trying to figure out, okay, how am I addressing this target? So let's begin with evoke. So evoking is when you're trying to evoke some kind of speech or language, because it's not just going to happen spontaneously. If that was the case, the person will probably be doing pretty okay. So we're going to plan our session to create these opportunities for this target behavior to occur. And we might begin our process here with instructions. So we're going to explain what we're working on and why. And that needs to be age appropriate. So if you're explaining it to your 12-month-old client, that's going to look very different than if you're explaining it to your 44-year-old client, right? And if we're talking about the little ones, we're also talking about, you know, those parents and caregivers and providing instruction to them. So your instructions are going to really give that foundation of what's the target and why. And the why is important. So one of the things I used to like to do with my graduate student clinicians was I would ask them, if I ask your client today, what are they working on and why, could they tell me? And that was always that little check of, instructions aren't something you just do once and then forget about. You want to make sure in an age appropriate way that your clients, your patients, your students always have a sense of what's going on in speech. It always cracks me up when, like, a school-based session, the child comes out and you ask, what do you work on? And they say, oh, we just play games, right? There's definitely a little bit of a disconnect about why they're there. And that feeds into their motivation and their desire to work on that target. So starting with instructions is important. Another aspect is modeling. So you're going to provide a model, and then your client will imitate that model. So your role is to be the model, and your client's role is to imitate. And certainly initially, you want to kind of show that behavior and then immediately have the client make an attempt at imitating that behavior. So you want it to be very close together in time. As you're developing the skill, you may find opportunities or rationales for having your model occur and then having a little more time go by before the client makes that attempt. But at least initially, you want it to be very immediate. And again, with instructions and modeling, at these early stages of your career development and your training, you're planning these things out like a script, like down to the words that you want to say, the phrases that you want to use, right? You're really going into it thinking about this in great detail. As you develop your clinical skills and you become more competent and confident, you may do this more spontaneously, right? You may not have a script of instructions, or you may not have the exact wording of the model that you're going to provide. You may be able to do it more spontaneously. But at least early on, you're going to write all about it. The other piece is prompting. So just like a model, a prompt comes before the client makes the attempt at the target. And the prompt is it's a little bit different. If you give a verbal prompt, it's not going to be the whole thing, because then that would be a model. It might be a partial verbal model, and that would be just a prompt. Prompts can also be nonverbal, like other types of gestures or other types of strategies to kind of clue the client into what they're supposed to do. And then, the other element of this is cues. And I've provided some resources on cues and prompts in Brightspace as well, so you can see more examples and kind of think about these terms a little bit. And then with all of these supports, with all of this foundation that you're providing, from the very beginning, you're planning how are you going to fade it away? How are you going to take those steps back so the client increases their independence and their ability to do these targets in different settings? Your end goal is to be completely useless to your client because they can do these things for themselves. So you're always thinking, how can I fade out? How can I get out of this? And then they can be doing these targets themselves. In the create aspect, you're creating the target. So in this situation, the client is not able to imitate a model. So you could provide a great model, but the client doesn't have the skill to do that model. So for example, in articulation phonology assessment, part of that was stimulability. So when you were looking at that deep result, you could see, well, was this little person stimulable? And that meant if you provided a model, could they imitate that model? So if they're stimulable, you're going to evoke the target. If they're not stimulable, it means they can't do it, even with modeling and instruction. Now you have to create that speech target. And you're going to use maybe a behaviorist strategy like shaping, where they've got some level that they can do, and you're going to shape using successive approximations or really small steps to get to the desired target. So you're really going to have to take whatever that end target is and do a task analysis and break it down into these small steps, and then plan out what level can the client accomplish with your support, and then step by step by step get to the target. Now, in some sessions, I may have this planned and I've got maybe 10 steps to shape toward a target that I'm planning to do. And I begin my session and we start with step 1. And that goes great. So maybe in that same session, I'm going to jump right to step 2. And maybe that goes great. And in that session, I'm going to jump right to step 3. And then maybe we'll spend some more time on step 3. But I feel confident and my client feels confident because they were successful at those earlier steps. I didn't kind of go too far forward so that they felt like they couldn't achieve it, right? I built success from the very beginning because these things are challenging. And again, I'm thinking about how can I fade my support? So as they're doing things with more independence, I want to get out of their way. I don't want to kind of give more support than what they need. Now, let's say your client has some of those target skills and you want them to do them more. You are going to increase that target. So when you're trying to increase a target, you start to think a little bit more about the consequences. And there's, again, this is a very sort of behaviorist lens, but that's okay. So reinforcement is going to increase the likelihood of that target response. Punishment decreases the likelihood of a response. And I think these are important definitions for these terms because we want to make sure we have designed our session and the consequences of targets in a very specific way. And we don't accidentally do something that we didn't mean to by not sort of scheduling it or thinking about it the right way. So if we think about positive reinforcement meaning we're increasing the likelihood of a target response, the target behavior. And positive means we add something. So just like a plus sign in addition, positive means you add. So positive reinforcement means we add something that will increase the likelihood of that behavior happening more and more and more. We can break down positive reinforcement into different types. One of those is primary. Those are things that are very much related to like your primary needs. So we often think of food and drink as primary reinforcers. If you have a student and you're working with that student on feeding and the consequences is they get to eat something that they really like, and that's going to increase the likelihood they're going to take a couple more tastes of something they don't like because you're increasing their repertoire. That's primary positive reinforcement. It's a food reinforcement. We also want to think about other types of reinforcement because it can't always be about food and drink, right? Conversation is not about food and drink. So social is a reinforcement designed to mirror natural social interactions. What are the things that people typically say to each other in our social exchanges that are reinforcing? So sometimes early clinicians end up saying a lot of phrases that are positive phrases, that they're supportive and they're nice to say, but they don't tie directly into positive reinforcement. So it has to be something that's going to increase the likelihood of the target. So if I say something nice, like my client did what I asked them to do and I go, good job, and then we move on to the next thing, I've said something nice, but it's not positive social reinforcement unless it increases the likelihood that they're going to do the target again. And if it's not part of your plan, I call it filler praise because it's just a filler, right? If you get good, great, way to go, right? If it doesn't have a purpose, it's not bad to say, but it doesn't have a purpose. So I call it filler praise. And if you're working with a person who has a really hard time with language comprehension or auditory processing, you don't want to use up a bunch of their language and cognitive skills with filler praise. You want to have them spend those cognitive resources on the vocabulary and the words that matter. So it's not necessarily like don't do it, it's just be planful. And if you're starting to feel like, geesh, I have to think about everything I'm saying and everything that I'm doing, you're on the right track, because you do. You really do. And that's part of this idea of building your clinical skill set and thinking about things maybe in different ways than you have before. It also has to be reinforcing. So this idea that it's been conditioned to be reinforcing. So a social reinforcer is conditioned because we equate this kind of social positive language with something that makes us feel good. And when we feel good, we do that behavior again. And that's why it's reinforcement. You also have this generalized conditioned reinforcement. An example of that is a token system. So if I work with a child and they can create like a cognitive capacity for tokens, maybe they get 5 tokens and they earn a terminal reinforcer. So 5 tokens for working, and staying focused. And then at the end, they get their terminal reinforcer. They exchange those 5 tokens for 3 minutes on the iPad. Or I used to have a little one who would basically work his little tush off to be able to play the game Spot It against me, because I usually beat him. So he was really motivated to try to win. And if you think clinicians let their clients win, you are incorrect. Sometimes if they're super little, we might be nice, but you kind of gauge the level of competition of the client. So he would focus for me. He would stay on task for the grad student if he could turn in those tokens to have a game of Spot It against me. And I got really good because I really wanted to keep motivating him, and I had to win to motivate him. So I challenge any of you to spot it. And then thinking about feedback. So feedback is about performance. So you're giving some feedback about that performance, like, did it go well? We can think of this as sort of social things we say, or we can even factor in biofeedback, like, are they getting a biological sense of what was going on? It's positive reinforcement if that feedback increases the likelihood they're going to do that target again. Negative reinforcement is the same idea, that it increases the likelihood of the target, but it does that by taking something away. So just like a minus sign in subtraction, you take something away. And that will increase the likelihood of the behavior continuing. So for example, if a child is on restriction from accessing the iPad, and they do the target behavior that you're looking for, and you remove that restriction, which they perceive as negative, and that increases the likelihood they're going to do that target behavior again, that's negative reinforcement. You took something away and it increased the behavior. On the flip side of this, we have punishment. And punishment has the purpose to decrease behavior. Positive punishment is, again, adding something to the mix. It's that plus sign to add it. And it's usually something aversive to the person, because it will serve the purpose of decreasing the behavior. So for example, a positive punishment is adding something to the mix the child does not like to decrease the behavior that you don't want. On the flip side, the negative is to take something away, right? Subtract something, also to serve the purpose of decreasing the behavior. So an example of positive punishment, and I'm sure none of you experienced this yourself, but maybe you saw some peers, would be detention. So if in school you got detention, chances are you were engaging in a behavior that your teacher wanted to reduce, right? A behavior they did not want you to be using. They add something to the mix that is undesired time in detention with the purpose to decrease that behavior. Does that make sense? So it's added. Now, again, I know it's none of you, but hypothetically, you might have known someone who got detention. On the negative punishment side, right, you're taking something away. So let's say that child is having a great time playing video games, and the parent says, it's time to clean your room, and the child flips out and has a whole angry meltdown. The behavior the parent wants to reduce is the angry meltdown behavior. So they take something away that the child wants, the video games, until the child reduces that unwanted behavior. Okay, one more slide, and then we're gonna take a look at the voice case. So to strengthen and sustain is where you've got the target behavior, and now you wanna make it as strong as it can be, and you wanna sustain it. When you're out of the picture and your treatment is concluded, you want that target behavior, that skill, to continue on and on and on, and then hopefully be groundwork for the client or student or patient to build more beyond that. So one of the things to think about is that reinforcement schedule. So reinforcement schedules vary, and your job in your plan is to be strategic about what schedule is going to be the best fit for what you're doing. So a continuous schedule is where the reinforcement is continuously present. And again, this might vary with different types of reinforcers. A fixed ratio is where it's a certain number of responses from the person, and that equates to a certain number of reinforcers. Fixed means it's always the same. So you can have a 1-to-1 fixed ratio. So for every time the child says the sound, they get a check mark on the chart, and that's really reinforcing for them, and they love check marks, so that's what you do. Other children, maybe it's a sticker chart. Other children, maybe it's adding the cards into a card game they want to play. So the spotted deck is a whole stack of cards. So in a fixed ratio reinforcement schedule, every time that child did the target, they got a card in the spotted game, and then at the end they could play. They had all the cards. Variable ratio is, again, that ratio setup, but you vary it and you do it in an unpredictable way. So sometimes it's 1-to-1, and then it's 3-to-1, and then it's 5-to-1, and then it's 2-to-1. So it's unpredictable. They don't know how many targets they have to do to get the reinforcer. They can't kind of guess. When you're initially working on a skill and you really want to get it established and strengthen it, you might start with a continuous or fixed ratio. But to get it to that next level of it's going to be as strong as it can be and sustain, you want to switch to variable ratio. Our human brains respond the best to variable ratio schedules. And if you think about something like gambling, like if you like to kind of put some money in a slot machine, it's a variable ratio reinforcement schedule. And you keep trying because you have hope that the next one is going to give you that reinforcement, and you're going to keep on working, keep going. Some things are more interval because they're time-based. So a fixed interval is something about time, like they're going to do this for 2 minutes and then get a reinforcement, 2 minutes and then reinforcement, 2 minutes and then reinforcement. It's fixed. Variable is the same idea, but you just vary. So this time they did it for 1 minute, they got the reinforcement. Next time they had to do it for 4 minutes and they got the reinforcement. Variable schedules are the most impactful in terms of long-term change. So that brings me to our practice. So you have a voice case in Brightspace, and you're going to determine a short-term objective that you want to work on, and what of our 4 areas you think it is. If it's evoke or strengthen, kind of where you think it fits in what we've just talked about. And then think about a possible activity. So you've got the Hegby book that has lots of info on voice. And then I also put a chapter from a treatment resource manual specific to voice, because the idea is you haven't had a voice class. So I'm going to stop my share. And I'm going to actually put you into 2 breakout rooms. And then Mia will be able to participate in a breakout room and observe. And then I'll jump between the two rooms, and whichever room you see me in will be the room that will be on the recording. So just so you know, that's how the system works. Before we jump in, are there any questions? Okay, I don't see any in the chat. So if you're in Brightspace, it's under session planning. And then the sample case voice. So you've got the sample case voice and then the chapter in the manual. And so this is a 53-year-old woman who, in addition to having some Botox injections in the vocal folds, she's going to also pursue some speech language therapy with you. So there's a medical intervention going on as well as your behavioral intervention. So you get a little background, and then you're going to really be looking at the recommendations. So at the end of that report, there's 3 recommendations of what those initial big long-term goals might be. And your job is to maybe figure out one objective that you want to work on. So you do have some resources here. So we're going to get started on that. And then when we start class next time, I'll have the groups report back and share. So we're going to spend the rest of class in discussion with your group. So wherever you end up at the end of class today is fine. And I'll jump between the groups. Sound good? Okay. So it's going to be two groups. Well, if it's 2 groups, it would be 4 people in a group, or I could do 3 groups with like 1 fewer. Do you have a preference? Is 4 too many, or is that good?
I think 4 is fine.
4 is good? Okay. And I will assign them. And then Mia, when you see it jumps up on your screen and asks you to join a group, you just click join. And then as I mentioned, I will circulate.
I'm from Williamstown, Mass. I don't know if you know where that is, but it's like very Western Mass.
How's your senior year going? Are you a senior?
Yeah, I'm a senior. It's definitely different, but
Heard to evoke speech is what it seems like.
Mm-hmm. That's what I think too.
I'm not entirely sure because I just skimmed through it. So
The first one says that she will improve her breathing during speech production by reducing tension, taking deeper breaths, exhaling before speaking, and not holding her breath.
so maybe she does. She doesn't. We don't have to evoke then. She already does it. So I guess it's, what's the second one? Shaping it.
Well,
Yeah.
if you do the evoke one, then you could do like for the modeling, you could like take a long breath out.
Yeah, and then she
And
can
have her take the long breath out, and then like almost
Okay.
breathing exercises, but not breathing exercises. But there's 3 other ones that we could use if.
Okay. She'll improve her breathing during speech production to reduce tension. I wonder.
You don't have access to these, do you, Mia? Okay, we're just peeking at like an evaluation report, which like says, you know, what the problems were and like all the background on the client. And then at the end, there is like recommendations from the speech pathologist, who was Debbie.
So something that stands out to me is like there's a lot of production by reducing tension. So reducing makes me think of a negative punishment, maybe. Just a thought.
I'm pulling back up. I've always been bad at this.
It also says like she will advocate for herself during conversations to reduce interruptions. So like working on like, I guess not like her confidence, but like making sure that she like lets herself be heard.
Yeah, and feels comfortable like doing that, speaking up.
Yeah.
Yeah, the whole like breathing part under 1 is a lot of that, like what we literally were just talking about, like the reinforcement and punishment. How old is she? Oh, she's 53.
And I think like for her age too, just like for 2, for example, for will participate in vocal exercises to support phonation. That would be like a reinforcer of like maybe a social reinforcer, because like the more that she does it, the better her phonation will get.
Yeah. And then for the second one as well, like reciting familiar passages and stuff and humming, like that could initially be done through modeling and stuff if she's unsure of like how to pace and anything like that. All I'm picturing for the third one is like intentionally interrupting her so she has to speak up, which is so so rude, but that's all I can think about.
I'm trying to think of what else. In regards to like the and it also just says like in the prognosis section
Hi, group.
Hello.
Just waiting for the other team to come back in. What do you think of voice? Interesting? Anything you've considered to this point? Maybe?
I considered like the transgender speech therapy.
Ah, great.
Yeah.
Okay, in the chat, wait till I say go. What was the most interesting thing? What was most interesting in class today? And don't hit enter till I say go in our last moment here. And Mia, you're welcome to share something if you would like to. What was most interesting in class today? And go. Oh, reinforcement. Looking at another report, one that you didn't have to write. Reinforcement, a simple check mark can motivate. Yeah, especially if you do it with zest, right? You make it special, it feels special. Yeah, filler phrases. I call it filler praise. I don't know if that's like legit out in the world, but man, my grad students loved when I brought up filler praise. Yay, Mia, you got to see a class for sure. Yeah, and a little bit about the major. Yeah, Emily, ABA. This is very behaviorist, what we talked about today, and evoking steps. Great. So I will see this class again sooner than usual. I will see this class again tomorrow. And Mia, it was a delight to have you. Thank you for joining us. And maybe we'll see you at our session later tonight, but please reach out if you have any questions.